Hi, I'm Stephanie Shelton, and this is Conversations on Health, How We Get There, episode 24. Do you perhaps know someone, maybe it's someone in your own family, who's spent some time in a rehabilitation facility, maybe after an illness or an operation? Lots of people, especially older people living alone, have spent time in rehabilitation or long-term care facilities. These are somewhat different from the assisted living or independent care communities that we talked about in episode 10, when we explored one family's effort to find a place for their mom that was going to be just right for her in North Carolina. Rehabilitation facilities are often affiliated with hospital groups, and they deal with everything from recovering from knee replacements to stroke to dementia care. The residents may be there for just a few weeks or much, much longer. So, why am I telling you all this? Well, my husband and I discovered that two of our good friends each had someone that they care about in a residential rehabilitation home at the same time. It's independently owned, it's in northern New Jersey. And one day they started talking about the issues that they've encountered, like staffing, like adequate physical therapy, mental stimulation, and the overall difference between this independently owned facility and the more common and usually larger company-owned facilities. So my husband said, producer of this podcast said, this could make a very interesting podcast. And then I looked at it and I said, yeah, I think it could be helpful. So we decided not to use the actual name of the place or of our friends. If you want to, you can just cozy up right now with a cup of tea or a cup of coffee and listen to the conversation. Maggie and Suzanne, thank you so much for coming on the podcast.
You're welcome.
You're very welcome.
And I have explained to some extent why I'm talking to you, because it's kind of unusual for two friends to find that two people who are close to them end up in the same rehabilitation facility, but that's exactly what happened to both of you. So maybe you could tell me, just to begin, how did it happen? Who was in the facility first and why? And then how did the other person get in?
I guess I'll start since
Okay.
my mom was in the facility first, and she had been there for probably about 2-3 years. And when Suzanne had her loved one he needed some help and assistance, I suggested the facility that my mom was at.
Okay, so it wasn't exactly by chance. It was.
No, in my case, this good friend of mine, dear friend, had already been in a couple of other facilities receiving rehab, and the insurance ran out. So the next option was to apply for Medicaid. And since Maggie's, mother was already in a Medicaid facility close by, his family looked into that and they were able to get him in.
Now we're talking about not a long-term living facility in the sense that you go in as an independent person and then get whatever tier of attention you may need as you age. Some people never need any and just continue to live in their own apartments and within the facility. And some people end up needing total care and you go into that. This is a facility that is for short-term and long-term rehabilitation, and then for long-term care for people with dementia or that kind of thing who will need that kind of care, who can't live alone, correct?
Correct. Yes.
Correct.
So in the
Really,
case,
it's full-time nursing care.
full-time nursing, yeah. So Maggie, in the case of your mom, that's what happened, right?
Correct. She had fallen and she needed care, and she could no longer stay independent because she was independently living at the time. And she really couldn't rehab and then go back to her room or her apartment and live independently. So we chose to keep her there and have her live there full time and get total care. So
And Suzanne, your friend is in because he had a stroke, right?
That's correct. He had suffered a massive stroke about 7, 8 months ago, and was not going to be able to return home and live independently. He was going to need and does need full-time nursing care, and there are no family members in the area that could even possibly provide that care either.
So this is an independent facility. It's allied with one other facility. It's part of a hospital healthcare group in the sense of belonging to the group, but it's independently owned. Um, I'm sure you both have looked at other places and have a sense of the fact that some of these kinds of facilities are owned by big companies now, multiple outlets, and some are independent like this one, some are for profit, some aren't. This is for profit, but it is independent. And on just thinking about it, does the independence matter when it comes to choosing a place like this?
In my situation with his family, I don't believe that was even a consideration. I think they were mostly looking into a place that would accept Medicaid.
Hmm.
He had prior been in a facility that was had multiple locations, a bigger name facility, but they didn't take Medicaid. So this was really a decision that was mostly based on the fact that they were Medicaid. And I don't know, maybe that's common in independent facilities too, because they can have that option if they choose.
Well, it certainly must be common in terms of looking for where a person is going to spend their time,
Absolutely.
because so many people cannot afford private insurance, and Medicare does not cover anything except 100 days lifetime of rehabilitation care. Nothing else, no other kind of care.
right,
You're on
right.
your own, baby.
Yeah, it's actually really sad out there. But I was also in a situation where my mother received Medicaid, and so we were pretty lucky with that too, because it's very expensive.
Certainly is. So overall, um, and I'll start with you, Maggie. What's your overall impression of the place where your mom is?
I am very happy there. I really am. I think it's a really, really hard job for these people, these caretakers, and but I think it's also very important that you show up and you are there, uh, knowing what is being done to your loved one and the person that you have in the facility. I think that helps. You also get a relationship with them, and I think that helps. But I have to say, I am pretty happy with the care my mom is getting, and pretty satisfied and very grateful to them all. I really have to say that.
And Suzanne?
I agree. From what I've seen, I feel like it's a very, and perhaps it's because it's an independent place and a little bit smaller, there seems to be a very intimate type setting there, almost like a family type atmosphere.
Hmm.
They really know all of the patients very well, at least on the floor that we both happen to have our, loved ones in.
Oh, so they're both on one floor?
They're both
They're
on the
both on
same
the same
floor.
floor.
Oh,
Right.
interesting. And
So
yet
we
they're there
often
for
run into
different
each other.
reasons.
Yeah, it's nice. They've actually, I think, gotten to know each other too, because
Interesting.
of our connection. But yeah, I would say overall, I've been very pleased, especially considering it's not a big fancy place, but as Maggie said, the work is hard. It's, these people really earn their money.
Are there enough activities? Is there enough stimulation? Obviously different for each of your people who are there, but um, you know, uh, do they have communal meals? Do they provide the necessary physical therapy? because sometimes a small place just doesn't do that.
Yeah, I think they have all of that. As far as physical therapy, I think a lot of it's based on insurance. And so I don't know if everybody's getting the proper physical therapy that they could possibly, that they could use.
I'm just gonna, guys, I'm gonna stop you for a second. You're freezing. If you're watching the video version on YouTube, you can see that Maggie's Zoom is freezing quite a bit. So we figured that it was the Wi-Fi. She asked her husband to stop watching Netflix, and then we continued. So we were talking about whether there is enough individual attention, is there enough stimulation, enough physical therapy, meals where people can get together and maybe talk a little bit, or anything that gets people out of their beds essentially in their rooms.
I think they're pretty good about it. I think the pandemic had a big impact on what they can and can't do. They can't always get the people in to maybe have entertainment because of the pandemic. People are still, I don't know if they're as afraid now, but for the last 3 years or whatever, they have been a little bit afraid. So I think that has a huge impact on how much they could do. But I can tell you, I think this facility tries really hard to do that. They have people come in with entertainment. They do picnics outside. They have vegetable gardens that these people are planting and stuff. So it's nice. And I think they try to get everybody out of their beds as much as they can. And yeah, so I think they do a decent job on that. I really do. They really do try hard to have them interactive. And they also, I think, Suzanne, I think you've seen this too. They have parties like once a month for all the birthdays. And they do have a very nice facility downstairs, like a dining room. It's very pleasant and very nice. So when they have a special event, they will bring them all downstairs, which is a lot of work to bring wheelchairs down and then do the whole party and then bring them all up or even outside. So I think they do a great job. I'm not sure what you feel like, Suzanne.
I agree. And when I look at they always provide a monthly activities calendar. When you look at that, there's a lot going on. And even every day, every afternoon, they have coffee and conversation. They have, just opportunities for everybody to hang out in sort of one big community room, and they can eat their meals in there as well if they prefer, or they can choose to have their meals back in their rooms. And their meals are brought to them, especially most of them are not mobile enough to go somewhere or go get a tray, so they're brought to them. They're in my friend's case, they have to open up the food, cut things up, and they do that, which is very, very nice, very kind.
Yeah. And I think in the morning they do like a little exercise thing too. They'll do beanbag toss or, I don't know, they'll whatever. Today they were watching a movie. The other day I was there, they were doing root beer floats. So I think they mix it up.
Well,
They try.
okay, stopping the interview again. You're still freezing. Unfortunately, Maggie's Wi-Fi problems continued, so we stopped the Zoom completely. She restarted her laptop, and this time, when we all got back together, it worked. Maggie, you and Suzanne both now have mothers in long-term care facilities. Did you exchange any notes? I mean, have you talked about the difference in the care, or any suggestions to each other, anything like that?
I think we have conversations and we compare the situations and but I guess I don't know what Suzanne's mom's facility's like. So I really don't have the comparison, but Suzanne would probably have more of a comparison. But as far as our situation, yeah, we talk to each other to compare things and learn from each other, really.
Right. Yeah, I think my mother is out of state in an assisted living
Right.
facility. And while she doesn't receive around the clock nursing care, she does suffer from, at this point, advanced dementia. So it's a little different. We've often spoken about the difference in why my mother is mobile, and Maggie's mother is not as mobile, but I think their level of lucidity is different.
Yeah.
Her
Well,
mother being
I
better than my
imagine
mother.
no two dementia patients are exactly alike, uh,
Yeah,
No,
yeah,
no.
right.
or in different stages, of the disease or something.
Yeah, it's like their needs are different,
Yeah.
and the facilities are different. So it's been interesting, in that way. And then again, also now both of us having me having somebody else who I know in the same facility as her mother.
Yeah.
So even just comparing that has been very
It's so
interesting.
cool that you have support because it's great support for each other.
Yeah, to be
Absolutely.
honest with you, we really are very lucky because we do really do depend on each other.
Yeah.
And we also have the privilege of going there together. And I can see Sue's friend and support him when I'm there, and Sue can do the same for me. And I guess we do commiserate a lot, and we can make a really hard situation a little bit lighter.
Yeah.
And
Yeah.
all sit together sometimes,
Yeah,
Well, that's
we
great. Like
kind
a
of,
one big family.
exactly,
yeah,
exactly.
That's cool.
yeah.
All right. So, let's get back then to your sense of the rehab facility. If someone were to say to you, what do you like best about it? What would that be? Maggie, you might want to start that one off.
I think what I like best about it, I think Suzanne actually touched on this. It's a smaller facility
Mm.
and it's a little bit, because it is a one man operated facility, I think it is a little bit more of a family atmosphere. And the consistency, if you have the same people taking care of everyone, it's you kind of get a relationship. You get a camaraderie and a relationship, and it just gives you a sense of security. And I like that. Like when I come in, I can say it's third floor, and it's like, oh, the A team's here. So they know me, I know them, and it gives me a sense of security that they are going to follow through and take care of my mom. So in that sense, I think I just like the smaller facility. So I guess that would be the best thing that I like about it.
Suzanne?
I agree. I would say the intimacy of being in a smaller place, this sort of family type atmosphere, I feel. They even know me now, most of the staff. Even, most of the staff is pretty consistent, but obviously at times they have to fill in with outside fill in people, but even they tend to rotate in, so some of those people who aren't there regularly, when they do fill in, I even recognize them and they kind of remember me. And even, the person I'm there for. So it's nice. And I think that continuity and familiarity is really the best thing that I have found.
All right, let's flip it. What do you like the least? Maggie?
Me first. Okay. I think what I like the least is that I think there's a reality that you have to keep your level of expectation really low, and just be grateful for what you have. You can't go into a facility like that and expect them to be at the level that maybe that you'll take care of your loved one or someone else. You just, I think it's sad, but you have to be kind of just grateful for what you get. So, and I don't, I guess that's what I like the least, because you want to probably have an expectation that everything's going to be just perfect and just done just the way you would do it, but it's really not the reality.
Yeah.
So, yeah. So,
Suzanne?
Yeah, I would say, kind of in continuing that, I think the reality that they're not in a facility where they're getting private duty nurses.
Mhm. Mm.
So they're sharing, and much of their care is given by aides, who are working very hard and are not doing, pleasant work by any means. And I think at times it's difficult. Their days are often as good as the care that they're getting from the aides. And even the aides don't always have great days themselves. And often that's taken out on the patients. And sometimes understandably so. Sometimes it's, I think, a matter of a level of training that they might need, of sensitivity to understanding the where these people are coming from, not just their physical needs, but their emotional needs. So that I would say is the biggest challenge. And as Maggie said, it's you have to kind of lower your expectations and remind yourself that that's where they're at, and just be thankful that they're safe.
It must be extremely difficult under any conditions to run that kind of a facility because most of the jobs are minimum wage jobs. I would imagine. Certainly they were at the one where my cousin was. And a lot of the people, I think maybe in a smaller place and in an individually owned place, as you said, you've got staff that stick around, especially if they live locally. But you got a lot of other staff that just drift in and out, based on, what's the place that's going to pay me the most this week or,
Yeah.
whatever.
Yeah.
And, so from the ownership standpoint, the management standpoint, they also have to deal with that. Um, would you have any suggestions in terms of continuing education or something that the ownership itself can do to improve the situation?
I'll let Suzanne answer that one.
Yeah, I do. And I've often said this, when Maggie and I would chat a little bit about some of the frustrations, particularly, I guess, maybe that I feel when I've seen it, is I think there could be better training, as I said, of the aid staff, because they're the ones spending the most time with the patients.
Mm-hmm.
And they change them, they bathe them, they help feed them and dress them. And if they're feeling rushed and frustrated, they sometimes, could take it out on that person without really understanding of maybe where that person is coming from. I think understanding, many of them are stroke patients and also dementia. Many of them are really not very mobile. And I think a better education for the aides to understand how to work with people like that. They certainly know how to, I'm amazed at how they know how to dress people and turn them around and get them in and out of bed into wheelchairs. They're phenomenal with that. But there's an emotional side, I think, that sometimes they're just not as tuned into because maybe they don't really spend the time focusing on that. And that's as much as I think as important to their well-being and the care that they get as the physical part. So I would say a little more training on that end would be helpful.
It may also be that on certain days they're short-staffed, and
On many days.
yeah.
Yeah.
On many
And
days.
and so when someone says, I don't have the time to spend, maybe they'd like to, but they just see this mountain of people they've got to get to.
Right.
Right.
And there's a reality to that.
Yeah.
Exactly. Exactly.
Um, so let's kind of go into wrap-up mode, which is talking about the future. Um, the baby boom generation is enormous. It's retiring in enormous numbers now, and with many behind to go. There are going to be people who are needing this kind of care, rehabilitation, and or long-term memory care in much greater numbers than anybody's ever seen at this point. And the facilities don't exist. The social care does not exist in this country or any country really to deal with that kind of a onslaught. So, do you have any thoughts going forward? What might be the best way to be prepared? I mean, should there be some kind of continuing education courses that are paid for up the line somewhere by some government entity? Should governments now be thinking, or private companies, about building more facilities?
Oh, for sure.
Where do you begin?
Yeah.
Yeah.
Well, I think definitely we really have to build more facilities. I know there's a lot of facilities that, it's independent living into the assisted living and then into, you kind of digress into, and there are facilities out there, but they're very, very expensive. But
Yeah.
I think we do need them for sure. And because the baby boomers are going to live longer. And so, yeah, we need that. And it should be a real big concern right now. We need it.
Suzanne?
Yeah. I agree. I would say, all of the above to what you had suggested, Stephanie. And on top of that, just valuing more the help that is the people who are there to help and to work in these facilities. Sort of like we had issues years ago with the education system. Teachers weren't
Right.
being paid or valued as they should, and that's still being, it's improved immensely, but it's still being worked on. And the same is here. You have an aging population, which is a wonderful thing, but they're going to need they need help now, and they're going to continue. So we have to watch the cost of this, but also how we're valuing the people who are providing this help.
Yes.
And
Yeah.
I think they need to be paid better and
Agree.
given better
Agree.
benefits. So,
I
yeah.
remember we had a news director in one of the stations that I worked on, the TV stations, and every time he gave a reporter some or a camera person some praise, he would be sure that they would come in and ask for more money. It was exactly the other way around. We didn't care so much about the money. We were all being paid decently, not great money, but I mean, it was union minimum or above. We wanted the praise. We wanted the recognition.
Right.
And we would have been so pleased if he had just said, you did a great job on that story. Your live shot was great. Those pictures you shot were fantastic. It would have been, oh, thank you so much. You would have gone home and had a bowl of ice cream or a drink. And money was not what you were looking for.
Right. Right.
So a little more of that,
Right.
perhaps, for these people.
But
That's
we
right.
will need more facilities for sure. I don't think there's
Yeah.
enough, and with the family structures too, it's not like the old days where, the families helped families. A lot of the kids are out and about and, they might be in California and then the parents are in New Jersey. It's not like everybody sticks together
Exactly.
anymore.
Yeah.
So I think that's a big concern too, is you're going to have more and more people that really need these facilities because they don't have that family structure, to take care of their loved ones.
Right.
And
And
also
people,
people can't afford to do it
no.
to
Right.
take care of their
People
parents.
it's not just that this huge cohort is retiring, they're living longer.
Right. Oh, for
Basically,
sure.
they come into it healthy enough to live into their 90s, but by the time they get into their 90s, they may not be that healthy and they need the extra help.
Right. Right.
So,
Exactly.
Yeah.
um, okay, so just to end this now, would each of you have any final advice that you might want to offer to somebody who's in the same situation as each of you is in right now, in terms of a person you care about being in one of these facilities?
Advice. Wow. That's a little hard. It's not easy, but I think my advice would be there, oversee what's happening, and you should be able to get decent care because part of the job is on you too to oversee your loved one. So
Suzanne?
I agree.
your
Yeah,
own
I
you kind
agree.
of have to do
I
your
would
own
say,
part, I guess. Sorry.
yeah, I think keep showing up as much as you can. And that's really what I'm doing for this friend because there isn't family in the area. And I know it's important that somebody is there
Mm.
to check in and, remember everybody in that place has had a life, they're
Yeah.
all human beings and the staff as well. I think get to know the staff, all, you know, of all levels, from the nurses to the aides to, you know, even the administration, and, you know, appreciate what they do, you know, but be open to communicating. And I think that really helps. It helps to helps resolve any issues that might come up, especially if you do it with respect and understanding on, you know, of where they're coming from, and then they will, I think, respect your concerns as well.
I agree with Suzanne, and just
All
good
right.
luck with it all. It's a tough process, but we're all going to be there, and we just hopefully do better. That's all
Yeah.
for
All
everybody.
right. I want to thank both of you, Maggie and Suzanne, for joining me today and talking about something that's not easy to talk about. Thanks.
Yeah,
Mm.
yeah. Well, it's
Thank
my
you.
pleasure. Thanks, Stephanie.
Thank you, Stephanie.
My thanks to our friends, whom we are calling Maggie and Suzanne. They're not in the healthcare professions, but I think you'll agree that their insights are really helpful. Now, in our next podcast, episode 25, we'll be taking a look at how community care is handled in the Netherlands. All healthcare experts seem to agree that good and affordable health outcomes are tied to better social care in neighborhoods, including rehabilitation homes like we just talked about. With a huge boomer population aging so quickly, the Netherlands has had a particular focus on integrated care, or to bring it down to our level, supporting healthy living, including medical care before it's needed. We'll be talking about how the Netherlands approaches it with Professor Dr. Mirella M.N. Minkman of Tilburg University, TIA's Business School, and CEO of VLANS, National Center of Expertise for Care and Support. I schedule one new podcast a month, so look for this next episode in September. Usually the drop day is the third Tuesday of the month. Updates on my show notes on my podcast page. I'd really appreciate it if you'd subscribe and, of course, share. Now, we're on Apple, YouTube Music, Spotify, TuneIn, Amazon Music, iHeart, Podchaser, and my host platform, the Podbeam app. The video version is on YouTube. Show notes and links on my website, www.stephanieshelton.com/conversations. If you like the podcast, please leave a review or give us a rating wherever it is that you listen or watch the podcast. I'm Stephanie Shelton, and until I see you again, please take care of yourself and all those you love. Conversations on Health, How We Get There is produced and edited by Frank Harold. Research assistance from Dr. Richard Saltman, Professor Emeritus of Health Policy and Management, Rollins School of Public Health at Emory University in Atlanta.